Welcome to the Neuropathy Support Group and Podcast. I'm Chris, and I'm so glad you tuned in. It's my hope with this podcast to help all of us gather information that might help those that need support dealing with this debilitating issue. Hello, and welcome to this podcast. Before we get started, let's get the formalities out of the way with the medical and privacy disclaimer. I am not a doctor or medical professional. The information on this podcast is from personal experiences and is meant for group support. Additionally, the information discussed is not meant to diagnose, treat, or cure any underlying conditions associated with neuropathy. All names here within are private and will not be shared with any outside sources. Please consult your healthcare provider before making any health decisions. If you have medical concerns or an immediate emergency, please contact your doctor or dial 911. Well, hello everyone. How you doing? Oh man, for the last 3 and 4 days, I have been in pain with my left leg, where they did that surgical procedure. I've noticed one of the veins is kind of puffed up on my leg, and it's really bothering me. But I can't get in there and see him until Thursday. So I'm trying to hang on there as much as I can. Again, I'm bringing this to you on Tuesday instead of Monday, so I apologize. It's just this week's been very difficult for me. So what I want to talk about today is a supplement that comes in different forms and uses different fishes to make it. And this is fish oil we're going to be talking about. The reason why I decided to talk on this is because I guess there's been some changes in regards to, the use of fish oil and how effective it is actually. So let's go ahead and get started here. Fish oil comes from many types of fish. The benefits of fish oil seem to come from its omega-3 fatty acid content. Fish that are especially rich in these oils include mackerel, herring, tuna, and salmon. And I know there's even an anchovy in there too, but I didn't know that they used all those different types of fish oils to make the different products. But the body doesn't produce many of its own omega-3 fatty acids. Omega-3 fatty acids reduce pain and swelling and also prevents the blood from clotting easily. Some fish oil products are approved by the FDA as prescription medications to lower triglycerides levels. Fish oil is also available as a supplement. Fish oil supplements do not contain the same amount of fish oil as prescription products, so that they cannot be used in place of prescription products. Fish oil supplements are sometimes used for heart health and mental health, but there is no strong evidence to support most of these uses. And I also have mental issues and of course the health issues, but I just take it because I've heard that it does these things, and I still take it even though it doesn't feel like that. It relieves me from any pain or my mental health. But I use it. But don't confuse fish oil with EPA and DHA, cod liver oil, flaxseed oil, krill oil, or shark liver oil. So now we're going to talk about the uses and effects of this. So these products are most often taken at a dose of 4 grams daily. While some non-prescription fish oil supplements might also help, these products contain less omega-3 fatty acids than the prescription fish oil products. People who need to take as many as 12 capsules of fish oil supplements daily to get the same effect as the prescription fish oil. So now we're going to talk about possibly effective for a procedure to open a blocked or narrowed blood vessel, which is what I had, angioplasty. Taking fish oil by mouth decreases the rate of blood vessel reblockage by up to 45% when taken for at least 3 weeks before an angioplasty and continued for 1 month afterwards. And like I said, I take it, but I've been out of it, so I've got another order coming in here this week. Taking a high dose of fish oil by mouth seems to slow weight loss in some cancer products. Low doses of fish oil don't seem to have the same effect. Kidney damage caused by the drug. Taking fish oil seems to prevent kidney damage in people taking such products. Fish oil also seems to improve kidney function in people who recently rejected a transplanted kidney and are taking other products. When we're talking about high blood pressure, it says here taking fish oil by mouth seems to slightly lower blood pressure in people with moderate to high blood pressure. It's not clear if it helps people with slightly high blood pressure or those who are already on blood pressure lowering medications. On rheumatoid arthritis, taking fish oil by mouth alone or together with other drugs like naproxen seems to help improve symptoms of RA. However, taking fish oil does not seem to prevent RA. So let's go ahead and discuss chest pain. Taking fish oil supplement by mouth does not reduce the risk of death or improve heart health in people with chest pain. So don't forget, we're talking about ineffective ways for fish oil. Taking fish oil by mouth doesn't slow down the progression or improve symptoms with your arteries. Taking fish oil supplements doesn't help treat or prevent eczema, but children who eat fish at least once weekly from the age of 1 to 2 years seems to lower risk of developing eczema. But man, what kid is going to eat fish at 1 to 2 years? Ugh. I mean, my parents, we would have fish like maybe every other week. And I wasn't really fond of eating, trout and catfish and sometimes bass. And like now, I don't even eat fish at all now. I just take the supplements. Irregular heartbeat. Eating fatty fish or taking fish oil supplements by mouth does not reduce the risk of irregular heartbeat. In fact, the risk of irregular heartbeat might be increased in some people taking fish oil supplements. But like when I post this website here, which is the WebMD, which is the one website I use because it's pretty much has talks about the extensive products, and it also talks about what's good and what's bad for you. So there's a lot of chest pain issues. Taking fish oil by mouth does not seem to prevent this condition, which is sudden chest pain. Abnormal heartbeat rhythms. Taking fish oil by mouth does not affect the risk of abnormal heart rhythms or reduce the risk of death in people with abnormal rapid heart rhythms. Also, diabetes. Taking fish oil by mouth doesn't lower blood sugar in people with type 2 diabetes. It also doesn't reduce the risk of certain complications of diabetes, such as heart attack and stroke. But taking fish oil by mouth might lower blood fats called triglycerides in people with diabetes. There is an interest in using fish oil for a number of other purposes, but there isn't enough reliable information to say whether it might be helpful. Let's talk about some of the side effects taking fish oil. Fish oil is likely safe for most people in doses of 3 grams or less daily. Taking more than 3 grams daily might increase the chance of bleeding. Fish oil side effects include heartburn, loose stools, and nosebleeds. Taking fish oil supplements with meals or freezing them can reduce these issues. Consuming high amounts of fish oil from dietary sources is possibly unsafe. Some fish are contaminated with mercury and other chemicals. Fish oil supplements typically do not contain these chemicals. When it's applied to the skin, there isn't enough reliable information to know if fish oil is safe or what the side effects might be. So now we're going to talk about special precautions and warnings when you take fish oil. So when it comes to pregnancy and breastfeeding, fish oil supplements are likely safe when taken by mouth. Taking fish oil does not seem to affect the fetus during pregnancy or the baby while breastfeeding. But swordfish, king mackerel, and tilefish should be avoided during pregnancy by those who may become pregnant and while breastfeeding. These fish might contain high levels of mercury and may contain other toxins. Limit your consumption of other fish to 12 ounces a week, about 3 to 4 servings a week. Consuming fatty fish in a high amount is possibly unsafe. In adolescents, fish oil has been used safely in doses of up to about 2.3 grams daily for 12 weeks. But young children should not eat more than 2 ounces of fish per week. Consuming fish oil from dietary sources in large amounts is possibly unsafe. Fatty fish oil toxins, such as mercury, by eating the contaminated fish frequently, can cause serious adverse effects in children. Bipolar disorder. Taking fish oil might increase some of the symptoms of this condition. Liver disease. Fish oil might increase the risk of bleeding in people with liver scarring due to liver disease. Diabetes. Taking high doses of fish oil might make it more difficult to control blood sugar levels. Okay. Well, I've been taking fish oil for some times, and I haven't noticed any issues with my blood sugar levels. Here we go with conditions in which the immune system response is lowered, including HIV and AIDS. Higher doses of fish oil can lower the body's immune system response. This could be a problem for people whose immune system is already weak. Fish oil might increase the risk of irregular heartbeat in patients with an implanted defibrillator. Stay on the safe side and avoid fish oil supplements. Fish or seafood allergy. Some people who are allergic to seafood, such as fish, might also be allergic to fish oil supplements. There is no reliable information showing how likely people with seafood allergies are to have an allergic reaction to fish oil. Until more is done, advise patients allergic to seafood to avoid or use fish oil supplements cautiously. So now we're going to talk about some moderate interactions. Even though it says moderate, you should take it as for what it is and make sure that you are doing this properly. Medications for high blood pressure. Fish oil might lower blood pressure. Taking fish oil along with medications that lower blood pressure might cause blood pressure to go too low. Monitor your body pressure closely. Next, if you're taking birth control pills, fish oil is sometimes made up of lower triglyceride levels. Birth control pills might reduce this effect if taken with fish oil. Let's talk about minor interactions. Medications that slow blood clotting. Fish oil might slow blood clotting. Taking fish oil along with medications that also slow blood clotting might increase the risk of bruising and bleeding. Warfarin. That's a product out there. I think I've used that some time ago. Warfarin is used to slow blood clotting. Fish oil might also slow blood clotting. Taking fish oil with warfarin might slow blood clotting too much and increase the risk of bleeding. Until more is known, use cautiously in combination with warfarin. Have your blood checked regularly, as your dose of warfarin might need to be changed. And medications for cancer. Some fish oil products contain a fatty acid that might reduce the effects of some chemotherapy drugs, called platinum agents. But the amount of this fatty acid in most fish products is probably too low to be of concern. There is no need to stop taking fish oil if you are also taking platinum agents. And finally, with this article, dosing. Fish oil supplement have most been used by adults in dosings of up to 6 grams daily by mouth for up to 12 weeks. Fish oil products typically provide 180 and 465 milligrams of DHC per capsule. Fish oil is also available in prescription drugs, including Lovazo and Epanova. Fish oil supplements cannot be used in place of fish oil prescription drugs. You need to speak with your healthcare provider to find out what products and dose rates might be best for your specific condition. So now we're going to talk about the reason why I wanted to talk about this product, fish oil. There was a study that just came out, and it says most fish oil supplements make unsupported heart health claims, finds a new study. Here's why experts say most people can skip them. For years, fish oil supplements were promoted as an important way to boost health and particularly heart health. But recent research has shown mixed results on their impact, despite some supplement companies continuing to promote their products as having a big influence on health. Still, nearly 10% of the U.S. adults take fish oil supplements. Now, a new study finds that many fish oil companies make claims that are untested and that a wide variety of amounts of omega-3 fatty acids, the core healthy fats in fish oil, are in their supplements. So what does this study say? The study finds that the majority of fish oil supplements on the market make health claims that aren't backed up by clinical trial data. And here's a little breakdown of what the key findings were. For the study, researchers analyzed the labels of more than 2,800 fish oil supplements and found that 2,000, or nearly 74%, made at least one health claim. The researchers noted in study conclusion that most fish oil supplements labels make health claims that imply a health benefit across a variety of organ systems, despite the lack of trial data showing how effective it is. There is also significant diversity and quality in the daily dose of EPA and DHA in supplements, leading to a potential vulnerability in safety and effectiveness between them. It's worth noting that supplements are largely unregulated industry in the U.S. Companies can put new supplements on the market with FDA approval. They're just expected to adhere to the FDA guidelines about safety and labeling. The agency also monitors reports of adverse effects after products are up for sale. So this is what it all comes down to. There are 2 FDA-approved fish oil-based drugs, but they're very specific indications, like people with high triglycerides. There is potential harm in taking fish oil supplements. They may have additives and fillers, and we don't know what they are. But fish oil can also raise the risk of bleeding and arterial fibrillation. This doctor here tells his patients that large placebo-controlled trials have failed to show any benefit of prevention of heart attacks and strokes. So if they are taking it to lower the risk of those, they can stop. There are far more effective pills to lower the risk of heart attack and stroke, and fish oil supplements aren't usually covered by insurance, so they can get expensive. This doctor recommends speaking to your doctor before taking a fish oil supplement. Initially, we thought that fish oil was better for treating heart disease than it turned out to be. Supplement labels can be confusing even for the most savvy of consumers. Patients should talk to the doctor about what supplements they are taking and why they are taking them. They may be surprised to learn that they are not getting the health benefits they think they are. And finally, I want to end this episode. And many years ago, I had an employee at a store he used to work at, and his wife ended up at the hospital. She was taking supplements, but she had been taking so many different kinds that they started interacting with themselves, and she ended up in the hospital. So you really need to be aware of what you're taking and let your doctor know what you're taking. I have a list of all my medications on my phone, and one of them is to have if there's any interactions with these medications. So you want to let your doctor know what you're taking to make sure that the medications that you're already on are going to be more effective or aren't going to be more effective, or they're going to cause illness of any kind. So make sure you stay up with your doctor. Hey, thank you very much for being here again. I'm sorry that it's a day late, this episode, but with health issues, it's hard to do anything sometimes. But I want to thank you for being here and being part of this podcast. And I will talk to you next Monday. Bye. As we come to a close, it's my hope this podcast and other sources, such as product reviews that I have discussed today, can better our lives and give us some relief dealing with neuropathy. This episode plus others are posted every Monday on Facebook, Twitter, Instagram, iTunes, Spotify, and Stitcher. And finally, whatever life throws at you, even if it hurts you, just be strong and fight through it. Remember, strong walls shake, but never collapse. Talk to you next Monday.